Charles, let's kind of get into the details of what you propose, because in your book, you essentially lay out this idea that, well, let's take everything, and I mean kind of everything that we would think of as far as our social welfare system today, let's kind of just throw it out the window and replace it with what you call a universal basic income. Can you just kind of walk us through, give us the overview of what you propose?
Sure. And first, I want to emphasize everything. So I'm not talking about Medicaid and anti-poverty programs. I'm also talking about income transfers through Social Security, through Medicare. I'm talking about all kinds of times in which the government takes our tax dollars and gives them to other individuals. And if you take all of that and cash it out, you have easily affordable, in fact, much less than our current system, a universal basic income. In the 2014 version of this book, I was saying it's going to be $10,000 a year per person aged 21 and older, plus $3,000 that must be devoted to purchasing a catastrophic health insurance policy. Those numbers would have to be higher if I were doing the program again now. How much higher? I have not tried to go through all the numbers again. Let's say, for purposes of the discussion, it's $15,000 in cash, plus an additional sufficient to buy catastrophic health insurance. That is deposited into a known bank account electronically every month, automatically in equal installments, to every citizen in the United States 21 and older, including people who are making millions of dollars a year. Why do that? Well, one thing is that right now you have costs that are levied on people making all income levels for Social Security and Medicare. And somehow you've got to compensate them in some way for what they're being asked to give up through a universal basic income. Okay, so that's coming into your bank account. And what I want to emphasize, that's it. You do not any longer have the option of trying to get help from the government to deal with any of your personal problems. That's all gone, whether you're talking about in-kind or whether you're talking about services or anything else. And that is, to me, one of the great benefits of the program, which is it can revitalize private institutions in a way that's just hard to imagine. One of the things that people do not do is look at how incredibly extensive voluntary philanthropic efforts were in the 19th century and early 20th century before government got involved. If you were to extrapolate the resources put into helping the poor to today's dollars and today's national wealth from what it was in 1900, you'd have expenditures that are not far behind federal welfare expenditures, but we undercut all that. So that's the basics. You also have a system for allowing people to keep the bulk of their grant up to a certain income level, and even after that, it's reduced only moderately. Again, I'll have to try to revise my figures from 2015 to today, but it would be, let's say, up to an earned income of $40,000. You keep the entire grant. So when you're at $40,000, you have $55,000, all right? And if you are a couple that making $40,000 each, you are now up at 80 plus 30 is 110. You start to lose some after that, but the work disincentive is very small. There are very few people who are going to quit $40,000 a year job because their $15,000 has been reduced by $700 for going over 40. This, I think, pretty well sidesteps most of the work disincentives that have plagued assistance programs since their outset.
Let's talk about that for a minute, because the work disincentives issue, that's something that is a big focus of what we do here at Sutherland Institute. We've been putting out some research and working on some policy reforms specifically to address benefit cliffs in the current social safety net, which for our audience, again, is when somebody earns a little bit more in terms of earned income, and that triggers a loss of benefits through things like food stamps or Medicaid or other programs that can, eat up most of or more than the income gain. And we have survey data showing it is a real work disincentive for a substantial number of folks on these programs. And so that really resonates with me. Can you talk a little bit more about how this proposal, in your estimation, would it have any work disincentives at all, or would it incentivize work in kind of a universal way?
Well, of course, one possibility is that people take their $15,000 and get out of the labor force and get along on that. Well, you can do that because $15,000 does not buy you a comfortable living, but it could be done. And if you have two people, that's $30,000. So that's a little bit easier. On the other hand, every dime you earn, if you decide to supplement that a little bit, you get to keep. So that if you have something you want and you can't buy it with this sort of slender guaranteed income, there is a real easy solution to that. I'm not going to get a 40-hour-a-week job, but maybe I'll go pick up a part-time job until I can buy what it is I want. You have all sorts of ways in which getting earned income is pure profit, and that's a big deal. A second thing I'd like to emphasize, Nick, is this business about if you want to have a comfortable income, it's really good if you can cooperate with someone else. And the easiest way to cooperate, besides roommates, which is always possible, is getting married. All right. And so you're now talking about a big difference in all of the calculations that go into marriage decisions, which we could go into in detail. I will say briefly for people who haven't read the book, I find these parts of the book some of the most fun to read and to write because some of the dynamics, well, let me just give you a quick example. Right now, if you are an unmarried woman and you have a baby, you get lots of money. By lots, generous support. If you are on a universal basic income, you're getting 15 grand, you have a baby, those diapers are all coming out of your 15 grand. So is all of the other things you have to pay for. It's pure loss. All right. Now tell me how that will affect the calculations of 18 and 19-year-old girls who are watching their older sisters or older friends, some of whom have gotten their own apartment with a roommate and are going to night school and doing things to get ahead, and others who are still living in miserable circumstances, paying for the diapers and all the child care costs. That's called a deterrent to having a baby without someone else to support it. Similarly, Nick, suppose that the man has no legal rights over a child at all unless he gets married. That creates a real incentive for the woman to demand that a guy who wants to live with her and sleep with her has to marry her because otherwise there's no way she can get child support from him. There, you sort of see the idea. The universal basic income that I talked about earlier in the broadcast, the agency it gives means that all sorts of demands can be made on people and all sorts of expectations can change in very positive ways.
That and what you mentioned earlier in the first segment about this idea of revitalizing, I think, civic institutions or private institutions. Can you talk a little bit more about that? The marriage piece obviously being important, but also when you talked about charitable giving and private charity and those kinds of things, I'd love to just hear you tell our audience more about how you think this plan would revitalize our civic institutions and sort of that layer of civic life that I think we all recognize has been seriously eroded in the modern era.
Well, a lot of what goes on when the governments get into these businesses is that the people who were formerly engaged in those get out of it because the government's spending these huge sums of money. And so why should I be doing that? And you can look at the history of philanthropic giving and during the New Deal, all sorts of money that had formerly been going to people in need was going to the opera or to libraries or other things that are good, but being taken out of that. A second thing is that this remains an extremely generous country in terms of the people. And Utah is as good a state as an example of that as we have ever seen. And that is, if tomorrow all of these programs went away, Americans, it is not in their nature to say, well, who cares? And you will have all sorts of people who have been enthusiastically advocating for the poor, who I would like to think, if those programs go away, will be devoting their energy to helping them, but also lots of people who are on the sidelines and devoting their energies to other things will get engaged in these efforts, whether they are through the church or whether they are civic organizations. Those organizations are still out there. And for all the people who live not in the New York or San Francisco or megalopolis areas, but live in cities of 15 or 1,000 or 75,000 or 120,000, knows that the civic activism that goes on is still very much like Alexis de Tocqueville described it in the 1830s. All sorts of voluntary organizations. And they will, if you get rid of the government, blossom again.
I want to spend a little more time before we go to the next break on some of the aspects of the plan you propose, because I think it's really important to the discussion. And there's two aspects you dive into in the book. One is healthcare, and the other is poverty specifically. And I want to ask you about healthcare because you make the point in the book that you argue the current healthcare system or the health insurance system sort of removes the consumer from the position of choosing or making decisions with respect to their own healthcare and the expenditures on their healthcare. Can you expand on that a little bit in terms of why is that a critique of the current system that we need to know, and how this plan would help fix that?
Start by thinking that the costs of routine health care should have been plummeting over the last 50 years. Instead, they've been rising steeply, but think of all the ways in which things are cheaper than they used to be, whether it's using adhesives to close wounds instead of having to have them stitched up, whether it is a pill to control blood pressure, whereas before you had no way of controlling blood pressure, whether it's surgical instruments that can be much less invasive and get people out of hospitals faster. You should be able to take care of routine healthcare costs the same way you take care of buying shoes and keep doing the upkeep in your car. They should be that inexpensive. Then if you get to catastrophic healthcare, you are talking about potentially being bankrupted. And because things are genuinely really expensive for catastrophic healthcare, well, guess what? Insurance companies, if you tell them this person is coming onto your rolls for catastrophic health insurance at the age of 21 and can pay $4,000 a year guaranteed ad infinitum, those health insurance companies can afford to have a very solid catastrophic health care insurance policy because they will use your younger, healthy self to pay for your older, sick self. This is not rocket science. It is not coming up with weird new ideas. You're talking about doing the same thing in healthcare that has produced computers which cost the same raw dollar cost in 2025 that they cost in 1984. You could buy an Apple computer in 1984 with 128K of memory for $2,500 in those dollars. You can buy a supercomputer for $2,500 today from the same company. We can do that with healthcare.
On poverty as well, obviously you orient a lot of this towards alleviating poverty. And I want to pinpoint one aspect of what you say in the book, because you essentially define poverty as the lack of means to provide for basic material needs for folks. And I want to kind of offer an analogy where I tend to think of poverty differently than solely a lack of material resources. And the analogy I use is that if you or I had a friend or a relative, come to you and say, "Hey, I'm down on my luck. I lost my job. I don't have a place to stay." And if you said out of the goodness of your heart, sleep on my couch, stay in my basement, eat whatever you want out of the fridge. No, you're fine. Don't worry about it until you get back on your feet. If that were me, if I were then to go and say, "Hey, I solved poverty for my brother or my friend or so and so," they're not poor anymore because they're essentially living under the auspices of my material resources. that would kind of be viewed as silly. Like, no, they're still in poverty. They are just able to meet their material needs for now until they get back on their feet. And so I throw that out. I'd love to hear your response to the definition of poverty as purely lack of material resources versus the definition of poverty as a lack of the ability to generate earned success to achieve work-based self-reliance. Maybe two different ways of looking at it, but how do you respond?
Yeah, when I talk about thinking of poverty purely in terms of material resources, I use that as an illustration of how easy it is to eradicate poverty. All you have to do is give them the money. Then they may misuse it or they may not, but if they're in poverty at that point, it's their own fault. And they don't need to be in poverty. But what you really want is the other elements of what I consider to be happiness, such as self-respect. And you cannot fake it with self-respect. You cannot have people say to you, "Oh, it's not your fault." You need to have a sense that you're pulling your weight. And if you don't have that sense, you are not a happy person. And in other ways, if you do not have intimate relationships with other human beings, which usually involve some kind of interdependence, you are not happy by my understanding of happiness. So I consider solving the monetary problem of poverty to be one of the least important in terms of the benefits. What I'm looking at are all the ways in which it is going to increase the earned success, which doesn't have to necessarily be defined in terms of income, the earned success of a lot of people who right now are living lives that are bereft of that.
Thanks for watching that clip of Defending Ideas. For the full conversation, click the link in the description and make sure to like and subscribe wherever you get your shows.